Everybody, here with Paul and Josh, and backed by popular demand, Dr. Zeke Emanuel. I'll get a chance to introduce more formally in a second. Our COVID daily summary numbers, I think the good news is it's now been more than a month that our positivity rate, the percentage of those who are tested who test positive, has stayed in a very narrow band between about 0.5% up to about 1.2%. Today, it's a little over, it's really 1%, and that's remarkably good news. Almost 13,000 tests performed. That would be, that's a lot. That's a universe of 150,000 in a week. Sadly, 6 more fatalities, and it's just incredible that we just passed a benchmark of 150,000 COVID-related deaths in the United States in the last 12 hours. Remember, we thought it might be 60,000. We'd be doing well at 80. It's going on, and it's continuing, and it's accelerating in a number of states. Our hospitalizations, 13 plus 13. I know when to worry at this point, and this does not worry me in the sense that the number of people being admitted to our hospitals has been flat. It is not going up. So the fact that we have 13 more people hospitalized just means there weren't as many people, exiting the hospitals. So I think we're in good shape on that front. The next chart, do you have that, Max? Is the reopening of the schools. And I just wanted to talk to you about that a little bit. As you know, when it comes to reopening of everything we've done in the state of Connecticut, it's been focused on public health. That's been priority number 1, 2, and 3 for us, has been public health. And that's why we've had Dr. Coe taking the lead. That's why we had Scott Gottlieb here a week ago. That's why Zeke Emanuel is here. And so we're going to talk a little bit about reopening now as regards our schools. And I think it's pretty timely that Zeke is here because he just had his op-ed piece in the New York Times yesterday, I think it was, Zeke, that was entitled, "Opening Schools is Not Easy, but Here's How to Do It Safely." I think that's fairly timely given this has been our focus over the last couple of weeks as we figure out how we can reopen schools safely. Just as a reminder, we're setting out some rules as we got all the information back from superintendents across the state. We've had a week to digest that. We're now going back. I've had a chance to talk to superintendents and teachers and students. And number one, we're going to be having the superintendents and the local district leaders determine what the mix is between full-time, in-person classroom and a hybrid experience back and forth. And I think that will be clearer in a second. It'll be guided by the metrics, the county-based public health metrics, the same metrics that we've been describing every day as we talk about what we're doing in terms of our COVID-related numbers. And we'll do that on a county basis. I'd love to hear Zeke's thought on that. We've got 5 counties here in the state, these congressional districts. We'll be doing that on a county basis, give a little bit of flexibility to those local leaders going forward. We'll be updating the metrics on a weekly basis. So, for example, if there's a spike in infections, there's a surge in hospitalizations, at that point we're going to be in a strong position to change course and get people in a different type of educational environment. So right now the metrics indicate we can have a classroom experience in class as well as a mix of hybrid. If there are any schools, for example, that say, I just want to do full distance learning no matter what the metrics indicate, at that point you go to our superintendent or go to our commissioner of education and seek an exception for some unique reasons. But right now the metrics indicate we're going to have a mix of in-classroom, particularly for the lower grades, as well as the hybrid, more likely in the upper grades where it's tougher to cohort. Let me tell you in the next slide why I think nothing replaces the classroom. And we've heard this in all of our surveys. Look, nobody's making a bigger commitment to distance education than the state of Connecticut. We have just acquired now well over 100,000 Chromebooks to make sure that no kid is left behind, no kid is on the wrong side of the digital divide. We're getting those distributed to those young people most in need. Secondly, as you probably heard, we talked about it the last couple of days, we're going to have the Wi-Fi hotspots so that those that don't have great internet connectivity will be able to go to the community center, be able to go to the library, be able to go to the park and do some ongoing learning along the way there. And that's going to be really key to what we've got to do. And as well, we're going to have wired connections which will be paid for so kids know that they can continue learning online. Those are for those kids who can't get the class, don't feel comfortable getting the class. And it's also going to be part of our educational mix going forward, because I think you're going to find online learning is a complement to what's going on in the classroom. That said, there are a lot of kids that didn't do very well with online learning in the last cycle. 25%, according to our surveys, 30% to some of what the teachers have told us, just didn't learn very well. We're learning from that. It was not simply a matter of connectivity, but sometimes it was lack of parental understanding, parental support, parental supervision, or lack of student interest. How to get learning online in a cohesive way is something that still takes work. We're going to do a lot better on it this time around than last time. Remote learners did learn significantly less in school than, less remotely than they did in the classroom. Something of real concern to me, and I hear this a lot, is 1 in 6 Connecticut students had family or health or trauma or other related reasons why they had to get to the classroom, other home life obstacles that were distracting for them. And you hear from our Department of Children and Families that sometimes these kids get to the classroom and you get a lot of feedback in terms of what's going on in home life. And that's sometimes how we're able to monitor the safety of the situation there. Other reasons we think getting back to the classroom is so important. Finally, I can tell you that we have our 211 hotline. The American Association of Pediatrics have all talked about depression and a sense of isolation. We have a great guy from United Way, Rick Porth, and whenever we did our unified command of all the commissioners, he'd always tell us the calls coming in to 211, and so many of them were related to young people who just had a sense of isolation. These are all the reasons that we're trying to encourage people to get back to the classroom, but only if we can do it safely. And finally, the CDC, a lot of kids, their main meal comes from the classroom, or their main meal comes from getting to school. So the school provides a whole variety of broader services. Anyway, we can get kids back to school. We can do distance learning. A lot of it's related to behavior. Connecticut's done very well because we have managed the behavior well. We've been wearing the mask. We've done the social distancing. But not everybody has. And this next chart tells you, Be Smart Connecticut. And what it says is, if you can see the headline, we're partying too much, says Gina Raimondo. A lot of parties in the state of Rhode Island, our next door neighbor, they have spiked up a little bit. It's disconcerting. It's not just the flare-ups in Florida or Texas, but they're now flare-ups next door to us in Rhode Island. A lot of those related to parties by young people. Phil Murphy, the governor of New Jersey, a little more colorful than your governor, I'm afraid. He says COVID-19 clusters from massive New Jersey house parties belong to the Knucklehead Hall of Fame. And this is why it is so important that you parents are there explaining to your kids every day why we're not doing this as punishment. You're maintaining these protocols, you're wearing the mask, you're not going to these big type parties where the infections are spiking up. And I'm not picking on New Jersey and Rhode Island. We've had some of these parties ourselves, and we're watching it like a hawk. This next chart sort of tells you what has changed and what's happening here. These are new cases by age. And just very quickly, I can tell you the biggest spike in new cases, Zeke, is related to those ages 10 to 19. In the last week, the number of people in that age group who tested positive has has doubled. And the 20 to 29-year-olds, the Gen Z generation, is going up dramatically as well. Zeke, the baby boomers, you and I, we have not gone up as much, but this is why it is so important that we keep an eye on these young parties where so much of the risk can take place. Look, with that, I really want to reintroduce to you Zeke Emanuel. Zeke has been obviously an advisor for us informally over the last few months, certainly. He was on, I think, 6+ weeks ago with Scott. And here's an update to say, how are we doing so far? Your observations on Connecticut reopening in general, reopening the schools. And we've talked a bit about what you're learning internationally and what we can learn from their example. Zeke Emanuel.
Thank you, Governor. It's a pleasure to be back, and I certainly hope that I can be helpful in shedding some light on this very important issue. Let me tell you how I think about education. I'm an educator. I'm a professor at the University of Pennsylvania, and so I take education very seriously. I do think we need to think of primary and secondary schooling as essential. It's kind of like as important, especially in the 21st century, as food and nutrition. And as the governor said, there are a myriad of reasons why it's absolutely essential for children. Educational attainment, we know online's not as good, especially for younger kids. Socialization, so children don't feel isolated and alone. All those social services that school are connected to, whether it's meals, monitoring for abuse, providing a safe place for students to be. And the last one, of course, is it's hard to get parents to be fully productive if they're at home, caring for their kids, cleaning the house, and serving as teachers' aides. So for a whole variety of reasons, I think schooling is important. When can you open schooling? And I think the governor was right. We recommended in our article that you have a combination of two metrics, low transmission rate in your community and a low test positivity rate indicating that you're testing enough and you're not finding lots of hidden cases. How do you get to a low transmission rate? The exact way that Connecticut has done it. And, you close non-essential businesses, you reopen them outdoors to minimize the indoor time, you physically distance, you have universal mask wearing. We know this works. We can see it in other countries, and we can see it in the states like Connecticut that have implemented this conscientiously. Let's be clear, we're not the pioneers here. Many other countries have opened their schools and opened their schools relatively well. Just a brief list include the Netherlands, New Zealand, Denmark, Norway, Finland, Singapore, Taiwan, Austria, Belgium. We're not alone here. Almost all those countries have been able to do it without flare-ups. A few countries, when they opened up high schools, had flare-ups. I know a lot of you are thinking about Israel. It is the exception, not the rule. You have many countries that have opened up without seeing a rise in cases. Israel, the opening of schools, was associated with the rise of cases. But, and let me emphasize a but, there are two problems with drawing too much conclusion from that. First, many things were changing at the same time. And as a recent report concluded about Israel, it said, a clear causal role for schools in this resurgence, however, has not been demonstrated, mainly because many other things were changing. The second point is that Israel did not prepare in any way with the near thoroughness that Connecticut is approaching this topic. They did not institute precautions such as face mask wearing, hand hygiene in the classroom, distancing, and the other measures. In addition, they sent kids back to places that weren't prepared with the public health measures we know. They went back to very crowded classrooms. Israel has got notoriously crowded high schools, and they did not de-densify. So when we think about opening schools, let me say we need to attend to every part. And again, I think and commend Connecticut for doing this. The transportation to school. We know that a lot of kids are going to walk, ride their bike, or be driven by their family. Some kids have to take a school bus. How do we de-risk that? Well, We reduce the number of kids on the bus, so each kid has his own seat and hopefully separated by another spare seat. You open the windows to keep airflow high. In the classroom, again, think about universal mask wearing. Think about distancing. There's attention to meals. How are we going to get students nutritious meals without crowding in the cafeteria to make sure that they don't infect the healthcare workers and that they actually don't crowd around together. You're going to have changes in athletics. Indoor contact sports just not going to be possible under these circumstances. And then you need to rethink extracurricular activities. Even with all these precautions in place, it's quite clear that not every parent is going to be comfortable. And that we understand. And it should be an option for them. In that regard, Connecticut is not going to be unique. Every country that opened up, there are a group of parents who are nervous. They don't want to be the first ones. They want to be sure that all the safeguards are in place, that the various kinks are being ironed out. Other parents recognize schooling's importance, the important role of being in person, the importance of the social activity for child development, and they want their kids to go. You have to have an option for those who are worried or simply cannot go to school because of other concerns in the house or because of health. And in that result, again, Connecticut stands out for providing students with computers, providing hotspots so every kid can get high-speed internet and actually do their work. This is let me conclude with the way I began. Education is essential. It's not optional in the 21st century. We need an educated student body and an educated workforce. We've got to get people back. And Connecticut is in a perfect place to open up its schools, given its low transmission rate and low test positivity rate. Thank you, and I look forward to your questions.
Well, thank you, Zeke, and Josh and Paul are here as well. Over to you, Max.
Channel 3 Eyewitness News.
Yes, Governor, touching on the Be Smart Connecticut initiative, we've been hearing of several cases where people might be getting careless when it comes to wearing the mask in public places, for example, outside in West Hartford Center, other downtown places. Do you expect to issue an executive order requiring people to wear masks in public areas?
Right now, you're required to wear a mask in public areas all the time indoors and all the time outdoors if you can't socially distance, if you can't keep at least 6 feet. And if you think we have to be stronger on enforcing that, we're going to enforce that because we can't allow these flare-ups to continue.
And I'd like to touch really briefly on the topic of the police accountability bill. We did an unscientific poll. 92% of our viewers didn't think that you should sign it. Are you seeing that type of pushback on your end? And what do you say to those people who are against this?
Well, I'd love to know what the question you asked them was. Did you ask them whether you think we ought to have more transparency and accountability when it comes to our police force? Did you say our police force has acted brilliantly, I would say, in most cases, in and around the protests following George Floyd, but that doesn't preclude the fact we ought to be able to hold people accountable? Did you tell them that we kept qualified immunity in place for all but the most egregious of crimes? I think you'll find people understand that the legislature made the right call.
News 8. NBC Connecticut.
Good afternoon, Governor. The districts were told to come up with multiple plans and spent the summer making them, now to be told that they need to pick their plans instead of the state making the decision. Some educators are criticizing that, calling it a cop-out, saying that you don't want to take the heat, so you're pushing it onto the local districts to decide. Just wanted to get your response to that criticism.
The other 90% of superintendents say, give me more flexibility. So we're trying to thread that needle by saying, here are the guidelines, how you can open your schools safely. Assuming the metrics are in a good place, this is how you open it for in-person learning plus a mix of hybrid. And if the metrics go in a different direction, this is when you should be closing your school.
What's your reaction to the teachers' rallies taking place across the state today?
I thought it was a little ironic. I was meeting with the Connecticut Education Association, probably 20 teachers around the table. We had a very constructive conversation for an hour or so, then everybody had to leave to go do a car rally around my residence and house. But we had a good constructive conversation, and I think it's important that the teachers be involved in the decision making.
And my last question regarding Eversource, lawmakers called for a peer investigation and a hearing. Have you had any contact with Eversource? Are you going to be taking any part in this?
I'm hearing it.
Reminder for everyone on the call to please mute your devices. Please mute your devices.
That sounds muted. Yeah, I got to tell you, our regulatory body that takes a look at electric utility rate increases is going to be taking a good hard look at the Eversource rate increase. You know, this current rate increase, by the way, is about 4%. About half of that is related to what the feds have ordered all the states across the country to do. I see that the Attorney Generals, Senator Blumenthal and William Tong, are challenging that, and I can understand why they're doing it. And along the way, everybody got a big electric bill last week, and much of that is related to the fact that you were home, it was incredibly hot, air conditions were on, and I think electric usage was up something like 35%. So we're going to do everything we can to help you have the room to make the payments necessary to do, provide you the energy efficiency that you need so we can hold down those electric bills going forward. All at the same time taking a look at that Eversource rate increase.
Thank you.
Fox 61.
Hi, Governor. Some teachers specifically don't feel comfortable being recorded while teaching come fall because, one, privacy concerns, and two, they say it will be difficult catering to those inside the classroom and those online at the same time. Can you address those concerns?
I got most of that. I think the complication of having a number of kids who are online plus catering in the classroom. I'll start with this, and maybe somebody can help me. What I've heard from other states that have done this well is they've tried to have a real synchronous online connection between kids at home and kids in the classroom. So it's not just an academic exercise you have at home, but there's also some social interaction, be it remotely, with the kids in the classroom. And that means that teachers are teaching the same way to the kids remotely as well as to the kids in the classroom. And it's also, we've thought a lot about those teachers that probably have a pre-existing condition or of a certain age where they shouldn't be in the classroom. Perhaps they can teach remotely, and you'd have an apprentice teacher in the classroom to help support the kids who are there. Any other thoughts on that, anybody? That's it.
WTIC 1080 News.
Dr. Emanuel said indoor contact sports are not possible. Of course, everyone has a question about the most popular outdoor contact sport, which is football. Is that possible this fall?
Hey, Zeke, the question was whether football can be played this fall.
I don't think so. I think that's, we recommend, if you look at our risk graphic, that contact sports of any type not be played. I understand, and believe me, I had I was a debater. Debate was a crucial part of my life. I was a swimmer, crucial part of my life. I understand giving up something that is a crucial part of your life. But we do need to be safe and put safety number one. And I think contact sports are not a good idea. NFL is going to try it with a bubble. You can't have a bubble in high school. You have transportation. You have lots of things which are going to complicate having a football season. I think, for 1 year, we're probably going to have to take a miss on it.
New York State delayed the season and postponed the New York State championships. Even that wouldn't be good enough for you here in Connecticut?
Well,
and if they did go ahead and do that, how would they proceed?
So here's the question for you. Postpone to when? You have to have some idea that this is going to be a significantly different scenario in a few months, in January. I cannot figure out what is going to be significantly different in January for kids in school that is going to really transform this. Let me just, play it out for you. Even under optimistic scenarios, if we had a vaccine proven effective, call it November or December, right? You and I and the average person are not going to be vaccinated until sometime in the fall of 2021. Just given the amount of vaccine we can produce, the logistics of getting it out. So I don't see postponing to January is really going to buy you a safe episode to actually play the game. So I'm skeptical that, that they're actually going to be able to adhere to, well, it'll start in November or December or January. I just don't see that.
And I think they're starting in September. They're trying to start in late September in New York.
Well, I'm in the prediction game. I make a lot of predictions, and I'm willing to predict it doesn't happen.
Hey, Zeke, let me ask a question on behalf of high school football fans. I agree with you. What does waiting 2 months mean? Are we going to have a lower infection rate than 1%? I mean, this is a pretty good time. But the inverse of that is, Zeke, what if you're just playing other towns in your region that all have a 1% infection rate? We are a pod in unto ourselves. Still too risky. It's a contact sport. Is that your point?
That would be my point, and I think it's possible to do it when you have a bubble, and you can be sure. But as you yourself have acknowledged, students will be students while the level across the country, across the state may be very low. You've had an outbreak among students, the 10 to 19-year-olds. That's what worries me. And that is the circumstance that I find particularly problematic. It is going to be low, and I do think community transmission has to be low, but there can be some cases of irresponsible behavior which may be too late to pick up before you have a super spreader event. And that would be, I think, seriously problematic.
News 12 Connecticut. The Associated Press.
Thanks, Max. Hello, everyone. Dr. Emanuel, Dr. Gottlieb was here recently and told us that Connecticut should probably try to get in at least a couple of months of in-school learning because it's inevitable that we will see an uptick in cases given the fact that there's such a large amount of traffic in and out of the New York, Connecticut region. We have a lot of travelers in the Northeast. Where do you stand on this? Do you think that this scenario will be that we'll have kids back in school for maybe a couple months and then they'll be back home again?
To be honest, no one knows. Is that a plausible scenario that might occur? I think the answer is yes. It might happen that way, especially if people get a little too comfortable, stop wearing the mask, stop implementing as rigorously all the public health measures, especially if they go indoors and aren't careful about how they socialize indoors. I don't know exactly what Scott was thinking, but if I had to guess, we start in late August, late September, late October. By that time, it's getting cold in Connecticut. We're having to close the windows in classrooms. We're not outside as much, and that increases the spread, and you simultaneously have this sort of excessive comfort leading to a little more or less adherence to the safety measures. That's what I suspect he's thinking, and as I said, that's a plausible scenario. I would hope that we could convince everyone that sticking to the public health measures is absolutely essential, and we can keep schools open for longer, for the whole term, if we actually adhere to them.
Thank you for that. And Governor, the Senate Republicans today sent you a letter urging you to reverse a decision that prevents nonprofit agencies that received PPP grants from receiving coronavirus funds. Is there any plans to change that policy? I guess a lot of these nonprofits, they say they need the money for PPE and thermometers and things like that.
Yeah, I agree with them. What we asked Melissa McCall from OPM to do was ask the not-for-profits what they had received in terms of a PPP federal forgivable loan, and that would inform our decision about how much of the CARES Act funding they would receive over and above that. And I think that's the information we're getting back from the not-for-profits very soon.
Yeah, and that I know that the Senate Republicans wrote that letter, as well as the Alliance of Nonprofits as well. There's been a clarification that's been provided to our agencies earlier this week, much before the Senate Republicans sent out their letter. As the governor stated, it was about understanding from the nonprofits what they have received in PPP. In terms of that funding, how that funding was used to make sure it's not duplicative of any CARES Act funding provided by the state. As you know, we are held accountable for any auditing for funding that is provided by the state to any entity that is not within the state. So that includes nonprofits, municipalities, hospitals, you name the such. So it's really about understanding from an auditing perspective and also understanding from a duplication perspective. So as the governor stated, yes, we do agree with that letter, and we've already acted upon that well before we received it.
Oh, okay. And Governor, to help my friends on the national desk at AP, what's your reaction to President Trump floating the idea of delaying the election because states aren't ready? And do you think that Connecticut's ready?
We're ready, the states are ready, and it's a really lousy idea.
Can I just say one thing?
Sure.
We didn't suspend the election during the Civil War. We didn't suspend the election during the Depression, and we didn't suspend the election during World War II.
Okay. Thank you very much.
The Waterbury Republican American.
Thanks. Sorry about that. Technical difficulties. Governor, could you please elaborate a little bit on your statement at the beginning of the briefing about school districts? I believe you said would have to apply to the Education Commissioner if they want to do full remote learning I guess, to start the year. And would they also have to do that if they plan to do a combination of in-person and remote learning?
Yeah, I'll start, and then maybe Josh can fill in the blanks on this. But as long as the metrics indicate it's safe to have in-person learning, we'd like them to have an in-person classroom capability as part of a hybrid plan, if that's the way they'd like to do it. And there may be some school districts that just feel anxious and they don't think any type of in-classroom learning would work for them. I think it's a mistake, but if they feel that strongly, they can go to see Miguel Cordona and ask for an exception.
Yeah, no, that's exactly it. I mean, the metrics that we'll be putting out next week, just to help guide the decision making, at least is where we stand today. There'll be no suspense. These are metrics we talk about every day, and the thresholds that we're at are well below the levels that would raise concern. So the point is that given where we are from a public health perspective, you know, the strong expectation is that we'll be seeing some amount of in-classroom learning for everyone starting this fall. But if for some reason a district is struggling with that, then they would need to come to the state for an exception approval.
And how long will that take?
Well, obviously, school year is coming up, so we'll be reviewing things quickly. But we hope not to have many of those cases, if any.
Okay. And maybe, Josh, this might be a question for you as well as the governor. I was just taking a look at the number of a chart on DSS assistance programs, and there's been a sort of about a 35% increase since early July, from about 2,600 cases now to nearly a little more than 3,550. Is that any kind of indication of how things are going out in the economy, you know, especially given the news today on the national level about nearly 1/3 drop in real GDP?
Yeah, no, I think we've seen a number of data points that continue to underscore that a lot of people are really struggling right now. We've also heard that there's been increasing demand at our food assistance programs. So yeah, there are certainly, unemployment remains very high. We're working hard to get people back to work.
And I was just also looking at the chart where we're seeing tests. I'm just wondering where are the increases in positive tests in Connecticut now? We have the overall number, but where are there pockets? Are there certain towns where we're seeing more cases now?
We comb through this data every day, and we're in a very fortunate position where there's very few areas where there are clusters of cases right now. The focus testing that we've been doing in our highest risk communities, in our cities, in our nursing homes, in our prisons, are all returning very, very low positivity rates, in most cases below the general population even. The governor mentioned earlier the one area that we're tracking closely right now are those younger kids where there's some unacceptable behavior going on, some partying, and some not adhering to the rules. So we're keeping a close eye on that. But beyond that, overall we're in a very good position right now.
Well, are we seeing increases where there's people in nursing homes? Is that I'm just wondering if there's any kind of pattern out there in terms of more cases in this part of the state than in other parts of the state?
No. Like I said, our nursing homes, we're very fortunate, very, very few infections, and staff or residents in our nursing homes right now. Really no clusters.
Okay, thank you very much.
Hearst, Connecticut Media.
Thanks, Max. Dr. Emanuel, is there a medical term for mask fatigue? People have been wearing them for 4 months now. Seems like their attention span might be waning. Do you have an opinion on that?
Look, I think on everything related to COVID, it's getting harder and harder the longer we have to do it, right? The longer we have to be at home, the longer our inability to travel, the longer we can't actually do the regular activities we do, whether it's going to the gym or dining at our favorite restaurant. I mean, it's a problem. Zoom fatigue is also a problem. I will say wearing masks is something other cultures do regularly and do for prolonged periods of time. And I know it can be hard. I'm not perfect myself. Occasionally I go out of the house and I forget the mask. That's why I leave some in, the car, the scooter, and other things, just so that if I have forgotten when I leave, there's one available. And by the way, pulling it down below the nostril makes it totally useless in protecting you and protecting other people around you. I think Americans are known for fortitude. We didn't get from the few colonies on the East Coast across the plains to the West Coast without a lot of fortitude. This isn't impossible, and I think I understand the fatigue, but I do think we have to rally around. It's good for us, protects us to wear the mask, and it protects our fellow people in Connecticut and around the country.
You can call it fortitude. I would call it manifest destiny. But, Governor...
but people had to do it, and the people who did it had to have fortitude.
Thanks. Governor, are you noticing any increased complaints to the 211 line regarding masks?
I have not heard that. No, I have not heard that, Ken.
And finally, if there were a spike in a particular region or town, would you consider locking down a town, city, or region to combat this? Are we like a couple of keg parties away in Westport from shutting down the town?
I put it a different way. Generally, I've thought about the state as one. So when it came to bars and restaurants, I didn't want people driving back and forth across the state to go around Westport to find a bar somewhere else. That didn't seem to make good sense to me. I think when it comes to schools, though, I can see why you break that down on a county basis if, in fact, which we haven't seen to date, that there was a flare-up, spikes, a much higher positivity, much more community spread in one region than another. Because schools are, by definition, a lot more local.
So then it doesn't sound like you would consider locking down a town, city, or region if there was a flare-up.
No, I tend to think of the state as one at this point.
Thank you.
CT News Junkie.
Thanks, Max. So I'm just going to go a little bit along what Ken was just saying. So if there is a spike in New Haven County, could they go entirely online as a county for school, but Hartford would continue as normal?
That's my understanding, yes.
And then can you explain how maybe something like the open choice program where children are bused from one community to another, if there's a spike in Hartford, will the open choice program students who go to maybe Portland be stopped from going to school?
Man, that's a very specific question, but I would think I would not want to have my kid go to a school where there's a great spike. That's for sure. I think the people in a very infected area should stay very close to home, and that includes the students.
Okay. And the guidance from the state yesterday said that masks are not going to be required for preschoolers who are in public preschool. And the Journal of American Medicine and Pediatrics came out with a study that said children under 5 can spread coronavirus just as easily as older children. So is that something that you guys may be rethinking?
Zeke, any thoughts on that?
Yeah, so I think the data on the spread of coronavirus by children is mixed. I don't think what you've identified is necessarily the dominant view. Most of the data suggests that younger kids below 10 and 11, first, less likely to get infected, less likely to spread. That doesn't mean that it's impossible. It just means, everything we're talking about is probabilities. And so I think that's a probability. Would you want to have kids, if they could, wear masks? Yes. And I will tell you here, different countries have different rules. So, some countries, young kids, China, Taiwan, Singapore, the young kids wear it. Other countries like the Netherlands, they don't.
Okay. All right. Thank you. And Governor, just one more question for you. Rodney Butler says that it's past time to allow the 2 casinos to offer sports betting and online gaming. Where do those conversations stand? And is it possible something could get done in September?
Anything is possible. We made a strong proposal, I think, some months ago that I thought would get sports betting off the dime, internet gaming off the dime in a way that did not invite any litigation. So looking forward to restarting those discussions.
Thank you.
Connecticut Public Media.
Good afternoon. Just last week, Darien had reported in 1 week 9 cases of people being between the ages of 9 and 19 with the coronavirus that are testing positive. Just wondering, so would that, hypothetically, if they were all high schoolers, be a big enough spike to shut the school down? And what kind of numbers would we be looking at come this fall with kids testing positive?
No, that's a pretty narrow group, it seems to me. Even better if they were all in one class, because we treat the classes like a pod, and then we could quarantine that class for 2 weeks and see what the spread has been. But it's something we watch like a hawk. I mean, I know about these parties. I know there were Juul and vaping going on there, and I know that it infected a lot of people in and around. So I cannot be more forceful in talking to them and talking to their parents. This is the time for you to show discipline.
Thank you.
The Hartford Current.
Hi, Governor. You mentioned that Rhode Island has begun to see a rise in cases. To what extent does that alarm you, given that in other outbreaks have been happening in faraway places where it takes a plane to get here? Rhode Island is obviously our neighbor. How worried are you that Rhode Island is starting to head in the right direction?
Oh, we're watching it very carefully, no question about it. We've seen, an increase. It's still below 5%, so relax, but the trend line is not good right now. Gina knows this all too well. That's why we've asked people in Rhode Island, enjoy your own beaches. And that's why I've told people in Connecticut, let's stay closer to home as best we can. I think that's the safe thing to do.
Would you have any hesitance in adding Rhode Island to the travel advisory list, or would that create any additional complications?
No, the advisory list is based upon the metrics. The metrics say you have a 10% positivity rate, you've got to quarantine. So there are no exceptions to that.
And I also wanted to ask, you just talked a lot about young people and parties. Is there anything that you can do to really discourage or to limit how much of that is going on, or are you kind of left to just plead with people to stay safe and plead with parents to make sure that they stay safe?
Let me tell you one thing. The parents are regulating this with other parents. And when parents find out that there was a party going on at somebody else's house and there were a lot of kids there and there was a lot of drinking and there was a real chance for infection, I can tell you the other parents are coming down like a ton of bricks. The power of shame is very powerful, much more than anything I can do by, edict or punishment.
Thank you.
The Connecticut Mirror.
Good afternoon. Governor, could you clarify what you meant by the fact that if a community wants to do distant learning, but yet the metrics indicate it's safe for in-person instruction, that they have to get an exception? So does that mean the state will retain control over that decision?
What that means is what it says, that if the metrics are low, the infection rate is low, and the folks like Zeke Emanuel says it's safe to have in-classroom learning. I want you to have in-classroom learning as a part of your educational opportunity there. If you've decided as a town you do not want to have any in-person classroom despite a very low infection rate, you have to come and talk to our Commissioner of Education and make a very good case why those kids would be denied an in-classroom opportunity.
But with whom does the final decision lay? Would that be Commissioner Cardona who would say yes or no?
Commissioner Cardona would hear the case made by that school that doesn't want to allow kids to go to a classroom and make a case, probably working in conjunction with the superintendent. That's a duck.
It is a duck. So, okay, look, a few weeks ago, you came out and you very strongly indicated that this is going to be a state decision, that if the metrics allow it, it's going to be in-person instruction. And then last week, you came out and you kind of surprised us and said it's going to be a local option based on options A, B, and C. And now today, you seem to be saying that this is ultimately going to be a state call. So, sir, what is it?
Look, I have not done anything by strict edict, but you know my feelings, Paz, that if their kid has a chance to get to a classroom, I want that kid to have the opportunity to be in a classroom. And I think in the overwhelming majority of our school districts, they agree. If there's a rare example with, despite a very, very low infection rate, some school district does not want their kids going to school, we're going to have a really forceful discussion with the superintendent about why that is. Can I force that school to open? Can I force those teachers in there? Probably not. But I feel very strongly if there's an opportunity for an in-school option, it's the best option for these kids.
And I just want to clarify a minor thing. You mentioned the 5 congressional districts and then counties. You are talking about county metrics, I assume, for the 8 counties, correct?
That's correct, yep.
Okay. All right, well, I'm sure we're going to pursue this subject again as final control, because it was, as you said, it was something of a duck. Thank you.
News 8.
Governor, this is Ann Nyberg from News 8. We've talked a lot about kids doubling with COVID 10 to 19 across the country, which is a big jump. What are you saying to teachers who are having to go into the classroom about COVID?
Yeah, Ann, great to hear your voice. Look, I met with the teachers today, and we said, look, if you have, you're of a certain age, you have a condition, a doctor does not want you going into the classroom, I don't want you to go into the classroom, I want you to be able to work from home, perhaps provide tutorial services, perhaps be able to teach a class over Zoom. For other teachers, I think it's incumbent that if the school is open, you go in there and have an opportunity to teach. I've got your back. We'll provide the masks. We're going to provide the disinfectant. We're going to put in place protocols that we strictly enforce to do everything we can to keep you safe.
When you met with teachers today, what were their biggest concerns?
Their biggest concern was, I think you're going too fast. Let's wait. Let's wait a couple of months. Let's see if the infection rate gets lower. Like Zeke said, maybe we're all going to have a vaccine by the end of the year and 100% of the people will take it. And I said, look, I can do everything. I said this to the nurses. I said this to the daycare providers. I've said this to the food service workers. I'm afraid in this COVID world, I cannot promise you 100% safety. What I can promise you is we're going to do this as safely as we possibly can. I've got you backed up in terms of what we can do to make sure you stay safe. I told the teachers today that when it came to the nurses, they had a much lower positivity rate than the general population, and they were going into an ICU unit back when the COVID rate was at 30% in this state. So we're going to have to work together on this with understanding, and I think we're going to get it done.
Governor, I thank you. Stay safe.
Thank you. All right, I think that's a wrap. Let me just say, Zeke, thank you again for what you've done here. I like academics and healthcare impresarios who speak English and understand what they're saying. And I always know where you stand, and I like that too, because I hear of a lot of on the one hand and the other hand in my job. And I'd like to say something about a good friend of mine, Oz Grable, who passed away yesterday, I think it was. You know, Oz and I set up a policy center at Central Connecticut State. Neither of us politicians, so to speak, in that world. He was running the Metro Hartford Alliance. I had my business, but we both cared deeply about public policy. We taught together. He was more Republican, I was more Democrat. We got into the classroom and really constructive dialogue. And it was pretty ironic there, 6, 7 years later, there we were in the green room, both gubernatorial candidates ready to go out and have a debate. And I've always loved Oz. I love him because he was substantive, his solutions were real, and he cared deeply about this state, and we're going to miss him dearly. Thank you, everybody.